Good morning, good afternoon, everyone, depending where you are. My name is Manisha Thomas, and I'm an independent consultant and very happy to be welcoming you this morning to our webinar entitled Towards Collective AAP Approaches at Country Level. It's the first of 4 webinars that's being organized by the IASC in collaboration with PHAP on accountability to affected populations during the Humanitarian Networks and Partnerships Week. So we're really excited for this first one and look forward to having you join us for all 4. And I'm so excited to see we've got participants from all over the world joining us today. So I imagine we're going to have a great set of questions and discussion with our panelists. As I'd mentioned before, this is the first of 4 sessions that's organized by the Interagency Standing Committee in collaboration with PHAP during the Humanitarian Networks and Partnerships Weeks on accountability to affected populations. This webinar is building on a number of discussions that have taken place in the IASC, as well as the PHAP webinars on AAP that were held last year during the fall, in the Northern Hemisphere, autumn. One of the things I think that's really important that we'll be discussing today is the fact that people in need do not live in silos, and their needs and priorities regularly cut across different programs. As a result, they're often faced with confusing and overlapping feedback and engagement systems. Collective approaches to AAP really seek to address this confusion and overlap by focusing on the overall humanitarian response and really putting people instead of projects at the center. And I think that's really important to remember, because we're constantly talking about putting people at the center, but we sometimes don't follow through. And I think these collective approaches to accountability to affected populations really helps us to remember that we're putting people at the center and to focus our systems around them. Our session today is going to draw from a few different contexts that have started the implementation of IASC AAP tools, such as the Accountability to Affected Populations Framework and the Results Tracker. It's going to focus on how they're contextualizing and operationalizing these tools and how this work is contributing to advancing collective accountability at country level. We've been joined today by a panel, and I'm really excited because I've seen some of the talking points, and I think it's a great lineup in terms of different approaches. And I'm going to first start just giving you an overview of who we have, and then we'll move into their presentations. And of course, you can ask questions throughout in the Q&A, and we do encourage you to do that. As well, if you haven't done so, please feel free to introduce yourselves using the chat function so we know who's there. So I know that many of you have already started doing that, and I encourage the rest of you to do that as well. So on our panel today, we're going to hear first from Jessie Wood, who is Chief of Emergencies and Transitions with the World Food Programme. Jessie's going to help set the scene by introducing a recent paper drafted by the AAP Task Force of the Interagency Standing Committee on the topic of collective AAP. Next, we're going to have Omar Derbas, who is the AAP advisor with OCHA in Gaziantep. And Omar is going to be speaking about collective approaches in the Syria response, mostly on the northwest part, but he'll also talk a bit about the whole of Syria elements. We then will have Franklin Maliba Sese, who is the AAP Collective Service Coordinator in the Central African Republic, who will be telling us about some interagency and accountability initiatives in CAR. We then have Yulia Pirig, and I apologize, Yulia, if I pronounced your last name wrong. I didn't get to double check that with you before, who is humanitarian advisor with OCHA in Ukraine and is going to be sharing some of the experiences of collective approaches there with us. And last but not least, we have Noella Cabale, who is a representative of the Refugee Engagement Forum to the Comprehensive Refugee Response Framework, or the CRRF, steering group in Uganda. And Noella is going to be sharing her perspectives on the participation of refugee communities in humanitarian response in Uganda. So welcome to all of you on the panel. Really look forward to what you have to share with us today. But before I turn to our panel, as Marcus already mentioned, and we hope that all of you have been able to introduce yourselves in the chat, and that you will start to share some of your questions so that our panelists can answer some of your burning questions. And you can also make sure that you can vote for other people's questions if they are asking one that you already want to know about. I'm just going to firstly comment a little bit on that first Menti that Marcus had introduced. And here we can see that the greatest challenge that you feel is out there for implementing collective accountability mechanisms in the context where you're working is apparently, first of all, a lack of overall coordination mechanisms, and quite close secondly behind, a lack of common objectives of organizations. And then also just a little bit further below that, funding structures and incentives. And the least greatest challenge, or the least greatest challenge, is about privacy and data protection concerns. So I think this point about those overall coordination mechanisms and common objectives and funding structures and incentives are things that we will be hearing about from our panel today. So hopefully we'll provide some ideas about how to overcome some of those challenges in the conversation today. Before we turn to the panel, we want to launch our second Menti poll. And the question here is, what are the priorities for improving collective accountability? And here you can just type in 3 priority areas, and we'll be able to see those later on in the webinar. So with that, I am going to turn over to Jesse Wood from WFP first, given he's been involved in that recent paper drafted by the IASC AAP task force on today's topic. So Jesse, what does this paper say about the current state of collective accountability in humanitarian action, and not just the paper, but in terms of the work of the task force, please?
Thanks, Manisha. Can you hear and see me? Great. Well, thank you again for inviting me to speak today, and good morning, good afternoon to all participants. So I'd like to give you a bit of a background on the paper, and to respond to Manisha's question. First of all, I think what the paper shows us is that there is a lot already in place vis-a-vis collective accountability and the work at the systems level that complements what's happening amongst different agencies. This is an issue of growing importance that's been picked up by our collective principles and the international community, but it still lacks from translation into practice in many cases, and coordination structures need to be strengthened. And so the paper took some time and quite a bit of effort to look into what's in place already and where we need to make our investments collectively to really move the agenda forward. So if it's okay with you, Manisha, I could actually present the outline of the paper. Is that so people can see what?
That'd be super helpful, especially since we can't share it yet, if I understand correctly.
That's correct. Unfortunately, it hasn't yet been approved by the OPAG, but we can certainly discuss its findings because we need to take that forward. So following the Interagency Standing Committee Operational Policy and Advocacy Group meeting, actually almost a year ago, 19th of May, 2021, we formed a time-bound task force to present a proposal to strengthen system-wide accountability to affected populations over the next 3 years. And this task force was co-chaired by WFP and IFRC, and was focused on the production of the paper I'm just presenting just now. The objective of the paper is to prioritize and advance collective accountability by ensuring that the humanitarian system recognizes affected people and the organizations that it supports as equal partners, safeguards their dignity, is empowering and inclusive, and commits to leaving no one behind. And so the paper presents a series of recommendations and an accountability framework to achieve that, which will be taken forward by Task Force 2 of the new ISC structure. So now, in terms of actually preparing the paper, I thought I'd give you a bit of background so you can understand the level of consultation and the degree of effort that went into this exercise. So the core membership included partners and members from the UN, as well as the NGO community, including 2 national NGOs. We consulted more than 160 people between September and October of 2021. So there's a very broad range, but including organizations for persons with disabilities, Indigenous peoples networks, Grand Bargain Participation Revolution Network, communicating with the Disaster Affected Communities Network, CDAC, the CHS Alliance, the IASC Secretariat, IASC Results Group 2 on Accountability and Inclusion, and a number of donors that are critical to this agenda, including USAID, BHA, FCDO of the UK, ECHO, Swedish SIDA, and SDC. So there was a very broad consultation process, but it was quite rapid and very involved. So the output has been the proposal that we're putting forward to strengthen system-wide accountability to affected populations over the next 3 years. There are 7 transformative recommendations within 3 focus areas. So the first focus area is an accountable and enhanced leadership. The second is an inclusive system and architecture. And the third is quality funding. So for an accountable and enhanced leadership, obviously we're looking for buy-in, and not just buy-in amongst leadership, but also direct engagement with affected communities so that their voices can affect decision-making. An inclusive system architecture speaks to coordination. And of course, quality funding is funding both for direct actions of accountability to affected populations, but also integration into existing programs and sort of financial models, I suppose, that support our operations. So in terms of the recommendations, I can give you these 5 highlights, which really cover pretty much all the points that the 7 recommendations put forward. So the first is for the ISC to establish an advisory body of affected populations to influence decision-making at the level of principals and the emergencies directors groups. So this, of course, speaks to accountable and enhanced leadership. Similarly, humanitarian coordinators who prioritize collective accountability to affected populations actions in HCT compacts. So we're translating that into structures at the field level within countries. HCTs to develop country-level AAP plans and ensure that representation of affected populations occurs in its decision-making. So both at global and at country levels, the engagement of affected populations. The next is for IASC principals to convene a meeting with donors annually to discuss challenges and opportunities. This is pushing towards the quality funding, as well as asking the Central Emergency Relief Fund, the CERF, and country-based pool funds to provide predictable and consistent support to collective AAP actions. So those are the top lines of the recommendations that get at enhanced leadership, inclusive system and architecture, and quality funding. Now, it's been, as I mentioned, quite an involved process. And so maybe I can flag just a few of the challenges that have come out of that, that I think collectively we need to address as we go forward. And perhaps even this discussion today helps us sort of bring these to the light. So the first thing we notice is that there's a lack of common definitions of what accountability to affected populations means and how that's institutionalized within organizations. And this, of course, is very important. So it's not just that we may have different acronyms or slightly different definitions, but this does lead to different interpretations and actions on the ground. There's also, differences in the level of ambition amongst different agencies. So how far should we push this process towards collective accountability, or where should we be sort of more reserved? Recognizing that different approaches may be required in different situations or by different, facets of the humanitarian response. And then, of course, we also need to, really identify concrete incentives for senior managers and donors. And I think this is still not clear. How do we really translate intention into buy-in and action at that level? So I think I'll stop there and then see if there's any questions from you, Manisha, or others. Thank you.
Thanks so much, Jesse. And it does sound like it was a pretty involved process to come up with those 7 recommendations within those 3 focus areas. And I think that the element of inclusion that you've got there, also in terms of bringing in affected populations, both at the global level, but at the country level, is going to be relatively or potentially quite transformative, because in a lot of our systems, we don't have that. Was there any thought given to sort of how are you going to identify those individuals? Because I imagine finding representatives from across different crises who are going to be able to also manage all our acronyms in our system and understanding how we all work is going to require a little bit of effort, but also probably some kind of mentoring or kind of support in order to navigate how the IASC works first and foremost, and then how country teams work, or how the systems at country level work. Is there any reflection on that in the paper, or is that going to be left to IASC Task Force number 2 to sort out those details?
Thanks for the great question. I know it's spot on. It's very difficult to look at or to come to an agreement on how voices of affected populations can be adequately and sufficiently and equitably represented in these sort of global processes. And I dare say also at the country level as well, there's a big question about that. And so we've tended to work through existing structures. I think that's very important because it gets at some of the issues you were raising in terms of awareness, knowledge, capacity to engage, and also it helps address the contextual issues that might be present in different locations. But that said, I think there's still a lot of work to be done in really agreeing on how do we identify the representatives of different population groups. How do we include them in these processes in an effective way that recognizes their own needs and ways of working? And how can that be both standardized so that we have consistency and agreement that this is legitimate, but also flexible to recognize different areas. And that certainly is something that the Task Force 2 is going to be looking at as it goes forward. And I should mention it, and I just forgot to say this when I was presenting the paper, that of course these recommendations, once they're agreed by the OPAG, then will come back to Task Force 2 to then determine, over the next 3 years, how we collectively want to move ahead on them, which ones will we prioritize, and what will be the specific actions underneath that. So it's really, there's a lot of work to do going forward.
That's great. And I'm glad that I'm not the only one who was thinking of that challenge and that there is going to be a way forward. When is the OPAG due to finalize the paper so that we can share it? I know that we've shared a previous document in the chat, but people are interested to know when they might be able to see the paper in its final form.
So yeah, this is outside of my realm of control, I guess you could say. We hope very, very soon, because the Task Force 2 is coming together in the next few weeks for its inaugural meeting, and we'd like this to be part of our initial discussion. So as soon as possible is what I would say.
Okay, wonderful. So if there's anyone in the audience with influence over the IASC operational policy and advocacy group, the OPAG, please feel free to push them to make sure that it does get finalized quite soon. And then when the paper is finalized, I imagine it will be available on the IASC website for those who would like to take a look at that. I have lots more questions for you, Jesse, but I'm sure we'll get some more in, and I hope that the audience will also ask some more. But before I come back to you, Jesse, I'm going to turn to our other panelists. But thank you so much, Jesse, for that overview and all the work that you and the task force members have done. Really appreciate that.
Sure.
Next, I'm going to turn to Omar Derbas, who is the AAP advisor with OCHA in Gaziantep. Omar, how does the structure of the Syria response, or the whole of Syria response, affect the possibilities for collective approaches to accountability to affected populations?
Yes. Hi, Manisha. Hi, everyone, and welcome. This is Omar Derbas. I'm the AAP advisor for Syria cross-border response, deployed by NORCAP and hosted by OCHA Turkey. Thanks, Manisha, for your question. It's really great to see many people on the call, very excited about the discussion for this session. So for your question, I wanted to share the lessons we have recently learned from a collaboration with the London School of Economics. They just completed, not published yet, a case study on cross-border mission for Northwest Syria. And they found, or we found together, that's the single most important factor in achieving accountability to affected population is leadership. Here, I wanted to share a bit about what leadership means in the context of AAP and how we put it into action in our response. First of all, just to understand why AAP is critical to our operation, you have to know that the humanitarian response for Northwest Syria is remotely managed from Turkey. So that means there is no presence at all for all UN staff, all international staff in the field of Northwest Syria. This means that there needs to be close working relationship between UN and the international agencies and actors in Gaziantep or in Turkey and Syrian NGO partners in Northwest Syria. Further, concrete mechanisms have to be put in place to ensure we, first of all, listening carefully to affected population. Second, it's about responding effectively. And third, communicate sensitively. And those are the main 3 goals for our AAP action plan for Syria response. And we just call it in our response the action plan for change. Remote response have historically been criticized for the obvious disconnection they create from communities' realities. Those, in order to try overcome some of those operational constraints, the humanitarian leadership in Gaziantep prioritized the development of a collective approach to deliver more accountable humanitarian response through the action plan for change. This is, from my side. Over to you, Manisha. I'm also happy to answer if any question regarding.
Thanks very much, Omar. And we look forward to when that collaborative study comes out. Do you know when that's going to be published?
It should be end of next month.
Okay, wonderful. And will it be on the OCHA Gaziantep site or?
No, it will be on whole of Syria level, but focusing on the 3 main different area of response.
Okay.
Some within Syria, Northeast Syria, and also Northwest Syria.
Okay. So
and on another layer of whole of Syria level.
Okay, interesting. Look forward to seeing that when it is available.
It would be interesting, yeah.
Indeed. And what progress do you feel has been made for collective approaches in the Syria response?
Okay, so last November, the humanitarian 2021 humanitarian leadership came together through the HLG or the HCT in our case to jointly analyze when an accountable or what an accountable humanitarian response would look like in our context. So, and then with a great support from the IASC and support of the other technical experts of the interconnected cross-cutting issues, because AAP is not a standalone subject, the AAP advisors, gender advisors, and also inclusion advisors, we developed an action plan for change. This action plan focuses on 10 main areas of work, such as, and the main one was the language challenges, and then gender inclusion and gender balance within the humanitarian structure, and also establishing a common community-based feedback mechanisms to collectively, and this is the most highlighted things, collectively ensure greater course correction. This is what we are looking for right now. Also providing further support on a technical and administrational level for Syrian NGO partners, and not only NGOs, but also Syrian networks. The action plan for change also, initially it's cover 1 year period, also wants to have members, as a colleague mentioned, of affected communities influencing not only the humanitarian decisions, but also funding decisions and engaging directly with the cluster coordinators. Putting the action plan I mentioned into practice, and also I wanted to maybe in later stage to share the action plan for change. I will share the link directly in the discussion or the text. The HLG, or again, it's the HCT in our case, instituted simultaneous translation as part of its monthly meeting. And also during the last 7 meetings, affected people were able to participate and share in the meeting and share their stories, concerns on humanitarian priorities during the meeting. After that, also through the action plan, we have pulled together a bulletin to capture the voices of affected people on key issue. And this bulletin also, it's public right now. It's called or named as the Community Voices Bulletin. It's bi-monthly published bulletin. For instance, and just to give examples on the humanitarian Community Voices Bulletin and the added value of keep communicating and hearing, listening from affected community. A huge concerns for affected people has been tents, always, all the time. For in our cases, almost, just for your information, 1 in 3 IDP households in northwest Syria lives in tents. Half of those tents during the last 10 years of response expired, totally expired. When winter storm and floods hit the area this January, over almost 50,000 people were affected. Anyhow, we responded and we provided aid and assistance, but in addition to providing the necessary aid, we began asking communities what kind of tents and living condition they prefer. We found that not only does warm tents fail to protect families, and some mentioned that our protection intervention became a risk for them, but some tents, even when brand new, completely fail to meet families' need. Communities had been sharing this information during the last 5-6 years, long time, and humanitarian leadership seized this opportunity to create change. In response to community those valid concerns about tents and living condition, the HCT agreed to shift towards dignified shelter and living condition. What that mean? This means an approach that adapts to the more complex intersectoral challenges of protracted displacement while remaining within parameters of humanitarian action. The dignified and safer living condition approach will enable the provision of safe, adequate, and secure shelters. This is in general, and also happy, over to you now, Manisha. Happy to answer any question. As mentioned, I will share the action plan for change in text part. Over to you. Thank you.
Thanks so much, Omar. And I think that's great that the humanitarian country team in your cases with the HLG are making it a priority to really listen to the voices of affected populations. And I think that example of the fact that they were complaining about the tents for so long and it's finally triggered a change really shows the power of listening to affected populations. I'm going to ask you a slightly, perhaps tricky question. Why did it take so long for them? If those complaints had been made for so long, why did it take them having to come to the HCT to really express those concerns before leadership took up the concern and decided to adapt?
First of all, it's about the severity of need and the keep increasing in needs in Syria in general within those years. And also we have this kind of complexity in the coordination structures for Syria response. And last point, it's about the remote management, as I mentioned to you. So those are the main things we're avoiding us to listening really carefully for people. We were listening, but through kind of the normal maybe actions like need assessment and some of those kind of things. But also we weren't responding effectively, and we weren't sending back or communicating back sensitively with communities. And this is what we change. We have another examples. If you want, maybe in later stage, we can highlight how listening to community could really change the quality of response.
Sorry, I hit the wrong button, but maybe you could give us that example now, Omar, if you don't mind. You know, what's a good example of where listening has had an impact and pushed for more quality responses?
So the gender balance and women participation from the affected community keep the most challenge in most of the responses around the world. The example I wanted to offer is related to difference that dedicated leadership makes. Really a great difference. Even before the creation of the action plan for change, the DRC, Deputy Regional Humanitarian Coordinator, made accountability and gender parity at the HLG as a priority. So the examples is about representation. 20 out of 39 current members of the HLG now for Syria cross-border response are women. The DRC, as I mentioned, the leadership pushed for the creation of women's advisory group. That women advisory group content of different levels within the humanitarian operation, including programmatic specialists, advocates, and leaders. The group is a unique really space for Syrian women to engage in high-level discussions. This is one of the outcome. And also this group encouraged affected women from the field and girls also to attend meetings and share their first-hand experiences with decision makers. And that's keep happening in a cluster, in the cluster levels, the protection cluster and GBV and child protection, keep having affected communities participating in their meetings, HLG, and also donor group meetings. That's the example I wanted to share.
Thanks very much.
It's really a success story.
Thanks very much, Omar. And I think that point you made there about the dedicated leadership making a difference is also very much reflected in the IASC paper that Jesse was talking about with the need for accountable, enhanced leadership. And I think making sure that we are putting those leaders in so that they are the ones that are dedicated to AAP and making that a priority is critical. And I think, Jesse, as you'd mentioned, it's still one of those things about how do we find those incentives to make sure that leaders do it, or also maybe the carrot and stick approach a little bit about, if they don't do it, are they being held to account if they're not making AAP a priority? So I think it'll be a really interesting sort of almost experiment to sort of see how that IASC task force number 2 is going to be able to really push for accountable and enhanced leadership, because I know that we've been talking about enhanced leadership and empowered leadership in the IASC for a long time. I mean, I was around when we did the transformative agenda and we were pushing for empowered leadership. And I think that the need to really prioritize AAP is something that we need to continue working on. Jesse, I don't know if you wanted to come in, if you had any reflections on that point around dedicated leadership and really how that maybe was reflected in the IASC paper. Were there some of these good examples that you looked at, like Mark in the Gaziantep approach, or as the Deputy Regional Humanitarian Coordinator, or were there others that you looked at, or good cases that you saw that would inspire others to say, yeah, that's what we need to do?
Thanks, Manisha, and thanks, Omar, for that very interesting example. To be very honest, I wasn't part of the actual dialogue, the research team, so I don't have all these great examples at my fingertips. I think there are out there many sort of innovative approaches, and there's many leaders that are already in place that believe in AAP and are finding ways to translate that into their actions in the field. But I can't give you one that's just like, hey, go for that and make it that way. But I think the challenge for all of us is to make that not just sort of based on personalities on the ground, but actually just part and parcel of how we do business as a humanitarian community. And so we need to have both, the carrots and the sticks in place. So leaders have to be accountable through the formal structures that the system provides. But at the same time, there's also needs to be a recognition of the importance of engagement with affected populations, and also the how to say this. I suppose that when we see good programming as a result of that, leadership has to be recognized for that as well. So there's a sort of the two-track approach.
Thanks very much for that, Jesse. And thank you, Omar, for sharing those examples from the whole of Syria and more specifically, Northwest Syria. I think operating in Syria is a particularly complex environment and operating environment. So I think that the fact that you're making inroads on AAP collectively is a great testament to the leadership and the dedication that's there. So thank you very much. We'll come back probably with more questions for you as well, Omar, but thank you in advance for sharing the link to that action plan, because I know that some had asked for it as well. I'm going to next turn to Franklin Moliba Sese, who is the AAP Collective Service Coordinator in Central African Republic. And maybe, Franklin, you can also tell us what a Collective Service Coordinator does. And if you can just tell us a little bit, what progress has been made for collective approaches in Central African Republic?
Thank you, Manisha, for this session today. AAP Collective Service Coordinator, I think that is the starting point for the collective approach. This is a really long-standing effort in Central African Republic since 2017, when I was first deployed here. And the AAP Collective Service Coordinator is that one who can really support the ICC, providing technical support for them to develop a collective approach. And now we start, getting these, having those progress in the field of AAP here. Among the progress is, first of all, the planning and the programming. Humanitarian planning and programming. For now, I think since 2020, our HRP is now being tracked against people perceptions. And that is a key point, because so far we have been using indicators coming from sectors. And as you know, those indicators are really narrow. Really narrow, and the need at the household level is cross-sectoral. So we needed something that can really capture everything that we are doing here collectively, and that the response is in the collective service, in the perception indicators. So we come together in the ICCs and among all the clusters and HCT to agree on a set of key indicators drawn from the core humanitarian standard. And we picked 8 indicators. Among them, for example, the coverage of essential need, do the aid reach those most in need, do aid worker treat people with respect, and all those indicators. And we pick 8 of them. And we also agree on the targets. For each indicators, we put some targets. That is really a challenging. And when I was working with cluster coordinator, I was surprised. They was giving to themselves a really higher standard for AAP, putting in each indicators higher targets. And then we start working with that. How now we can track our response against those collective indicators across the response. And that is what we are doing so far. If you check in our HRP, you will see that at the intersectoral section of the HRP, you see the 8 indicators, and the 8 indicators track the overall response. And what we do now every year is to run a statistical regressive regressive statistics so that we can track what we are doing this year against last year along each of those indicators, and to see our line of force and our line of weakness and how we can improve. And doing so, we have seen since 2019 and since 2020 some key trends. We see, for example, that people who receive cash, for example, tend to have a really good perception of the response compared to those who don't have cash, who receive in-kind assistance. So we know that is the factor. The cash program is a factor that can impact the perception of people on the response. And that's understanding at the strategic level really support the decision to really scale up the cash approach in CAR. And I think the cash approach in CAR is one of the best now in the region. And I'm really happy to see how my colleague in cash program are working, taking into account AAP, and we keep supporting them now doing the cash barometer and doing deepening the perception of those receiving cash. That is something concrete that comes from how using perception indicators can really help us to see what is going on across the response. The second progress, maybe, that will be the deployment of the AAP collective mechanism. And I like here to make some distinction about the collective mechanism and the collective approach. The mechanism are mechanics. But before putting them into place, you need to have a collective approach, how you can handle it, how you can deploy it, how you can design it collectively. And that is what we have done. Now, the collective approach gives us the collective indicators, the perceptions, and now give us also the model of mechanism that can be deployed in the field. And for that, we developed a collective project, AAP collective project, because we need some funding for those mechanisms to be deployed. And thanks to those funding from donors, we have been able to deploy across the country 5 models of collective mechanism. I will not get in details on those mechanisms, but what we get from the collective service mechanism is how a range of feedback that you can have in 1 year or 6 months on 1 year or 1 month. So you have just a broad range of data coming from affected people. I can give an idea so that you can have the scale. From last year to now, we have around 10,000 of feedbacks coming from affected people, and across the response. Shelter, health, wash, and you have them all there. So the next point was also to capture what organization at their individual level of organization are getting as feedback. And so the first step we've done is to map out all the mechanisms countrywide. So we have identified around 850 feedback mechanisms across the response. And now we need also to put into place a system. Now, that is another thing, the system, so that we can channel all those data. That is another challenge. So we have data collected most of the time manually, but those mechanisms need to be channeled, to be trained out, so that we can have a clear picture, actionable recommendation, and then we can start taking action at the individual level. And then we start seeing other challenges coming up. The first challenge is when we are collecting feedback, we are collecting data from our mechanism, we have 2 sets of data. We have really individual feedback, concern coming from households for which they need response. People need need to get food, and they come with a feedback like, oh, my name is not in the list. And that is not to wait for the trending. We need to be able to collect, to check, and to respond at the field level to the need coming or complaint coming from household level. At the same time, we need to have a broad picture to adjust the response across the collective response in the country. So we have to manage between the two. How we can respond individually when we are collecting those mechanisms, and how we can respond broadly when we are collecting those mechanisms. That was another challenge. So we need to come up with technology. That is key point. We cannot keep doing this manually as we have been doing. We need technology that can sustain and respond to those challenges, and that is what we have done. And I really here need to thank our colleague from ETC, the cluster ETC, and they have a really nice program, S4C, Service for Community. They really support us. They come up with a great idea. They develop an app that is one of a good app I've never used. The name is ETC Connect, but the commercial name of the application is Sugar CRM. And Sugar CRM is not like Kobo. Kobo, it can do everything that Kobo do, but the best is that they can collect data, trend the data, but they can channel the data instantly. For example, you get feedback on wash in one area, we collect them, and that ticket is sent straight to the wash implementer in that area for them to take individual action. That is what we have done last year as a pilot, and with a really effective result. We have been able to close more than 90% of the feedback received in Brea, for example, that is our pilot area, more than 98%. So a worker, our colleague working in WASH sector, health sector, protection sector, they receive the ticket on the feedback given in household, and they have responded to them. That is something really, really great. But we still have this challenge to deploy this system across the response countrywide, so that we can support both collective services and mechanism and NGOs. And then come the problem of data protection, IPC, information sharing protocol, and what protocol we can be using to share all those data. What is the SOPs that we can be following? And then we need to agree on this. And that is what we are doing now. So we have that. We craft with OCHA, with WFP, with other agency a draft, and we'll be discussing on this. So one problem brings a challenge that needs to be addressed, to move to the next step. This is a stage approach. So we cannot just go and do AP like is designed in the paper. We need to have a stage approach, because each stage is a challenge coming up for the next. If you don't resolve that problem, you cannot move across another stage. And now coming the problem of coordination. And that problem of coordination is when you have those broad range of data that you trend, and you know the trend, and then you need to take action. You cannot take action if you are not linked to a coordination system. So what you have done and was thinking so far was that the HCT is a powerful body of coordination, and the HCT can respond to everything that we come from the field. And then we come to see that is not true. Each coordination body is a locus of decision, and those decisions can affect the response to feedback and complaints. And we need to leverage we need to use them as a point of leverage, so that we can really act on people feedback. That's the reason why last year we tried to deploy, to decentralize the coordination of the AAP in the regional level. And we started to Brea, the same place where we pilot our ETC app. So what you have done there is really to bring in all those field workers working in that area so that they can analyze what is the trend of the feedback collected in that month and what is the collective issue that is raised from those feedback. And they take also a collective action in using the power at hand in the area of intervention. So we see something, for example, in the camp, IDP's camp in Brea, that okay, the collective issue was on sanitation, and that feedback was coming over and over and over, and they needed a collective approach. And the collective approach come with Oxfam and other organization coming together and say, okay, let's do this sanitation, let's fix this sanitation issue. And then they start doing those sanitation intervention as a campaign, block per block, and they was really responding to this thing. The problem's still there, but the response is also there, and we keep communicating with them on the response and what left to be done. So the coordination is really a key point where we can be able to effectively act on feedback at the field level, regional level, and national level. So by leveraging all those points of coordination, then we can have a broad picture on how actors can take a decision on acting on feedback. That is our approach. That is also what a AAP coordinator, a collective service does. So to design all those things. That is what I'm here to support all those coordinators. But I'm not alone. I'm here with my colleague from OCHA, who is really supporting me on this coordination thing, and that is really a good thing. But is a long-standing effort that need to be kept in on time. And I like, for example, I want to close here, but by saying this, I don't really think that we can use the word funding for AAP. Is investing in AAP, because if it's just like funding a project, we see nothing will happen. So we need to be able to invest, and our the donor who's really supporting the AAP here is investing in the AAP in the way that to generate value across the response, and that is the example of the COP. Thank you.
Thanks so much, Franklin. And that's it's an impressive piece of work that you've done, as you said, in a very staged approach. I mean, when you said that there were 850 coordination mechanisms in CARB, I went a little bit like, whoa, that's a lot. But I think the fact that you've been able to use that app, which seems incredible, to be able to use that to getting the tickets, and that you're able to get the feedback and close the feedback at a high rate, I think is excellent. And the collective approach that you had, I mean, what really drove it? I mean, I know you said you have to bring people together. Was it because leadership was invested? Was it because you were driving it? You know, how did you get to that collective approach? And also, sort of one of the questions that came out was, can you share the app without sharing any of the information? Is that app publicly available for others to use?
Oh, thank you. So I think our colleagues from WFP and ETC, they know those apps, they can share it. And I think that is something public. You can just buy it. It's $60 for a license. And yes, so is really is not that expensive. But everything is how you design it. And what you have done here is the process of designing the template, the template that can be used in the app, and that is the collective effort to come to do that. Yes, I have to register all those progress that I've just shared with you today is about the leadership. Is really about the leadership. You don't have a leadership behind you. You will not have this in the HRP. That is clear. You will not have the funding. You will not have it as a priority. So yes, so the leadership is the key point. You can even not have the decision to hire or to get a AAP coordinator. For me to come here, the decision was from the HCT 2016. So the HCT take the decision at that level to say, okay, we need a collective, we need a AAP coordinator in the country, and they put the collective service as one of the area in the core compact. That allowed me to have a framework so that I can support the initiative in the country. So that is a really standing effort, but with a clear leadership and sometimes empowered leadership, because I know that in most of the case, someone needs to stand up and then just take the decision and move the agenda forward.
Thanks so much, Franklin. There was just one question that we've got. I mean, we do have a couple of other ones. Just a quick one. Is it the staff of organizations that are submitting the tickets and the kind of the feedback into the app, or is it the population? I know that Hadi, I think, wrote that I think it's the staff. Hamdi, sorry. I think the affected population, but the staff will be the one who updates the app so that feedback can be resolved. Is that correct?
Yes, the feedback, the tools is used as the tools support the face-to-face conversation. And for example, I can just give this example of the IDPs camp. We have in the IDPs a information and feedback center that is a one-stop shop where all the IDPs in the camp can just come and then share the feedback and complaints for for all the intervention in the camp level. So there is always someone there, so they can collect those feedback using this app. And then when you collect it, if it is wash and all the cluster partners working in this camp, they are in the app. So when the ticket is generated on wash, they are the one who receive it, and then they take action on this. And as I said, this is still a pilot. We just tried last year, and that was in one area, and now the next is to deploy it. It was in Brea, and we are now working with WFP, and WFP got funded just to deploy the tools across the response, and we'll be working with them in the coming weeks so that we can have this plan to deploy the app and to agree on the ISP information sharing protocol and SOPs, and then everybody maybe will be using, but the condition is to sign.
Interesting. I think that's great that you're moving towards those information sharing protocols. And I know that those are sometimes some of the most challenging elements of collective feedback mechanisms, but it's great that you're working there. There is a question from Irfan Ahmed who asked, but while technology can be helpful in areas where internet connectivity is a problem, it remains a big challenge in remote areas. How are you going to manage that connectivity issue, or has the ETC already sorted out connectivity across car for you?
Yeah.
Supported.
Yeah.
Yeah.
Yes. And that is really what is genius with this app, the ETC app. Our colleague from ETC, they designed it in the way that you can collect feedback in a remote area, and when you come back in the office, and then you can connect it in the internet. It doesn't even take a broadband, and then all the data will just be channeled in the backend.
That's wonderful. And just for anyone who doesn't know what ETC is, it's the Emergency Telecoms Cluster.
That is correct.
Wonderful.
Yes.
And Jesse noted, thanks for that, Jesse, that the software is called Sugar CRM, and it's a form of customer relationship management software that's being adapted for AAP, and WFP is adopting as a corporate standard. And I know that in many different contexts, there's often attempts at creating sort of AAP collective feedback mechanisms, and the technology is not always shared across countries. So if there is technology that's being developed that can be used more broadly across countries, I think that would be great. So we don't reinvent the wheel in different places. But Franklin, thank you so much for that great example. Really appreciate it. And that point again comes back to that leadership really being key for any collective approaches to really work. I just wanted to talk about some of the comments that have come in through the chat, and then I'm going to go to the word cloud before I come to you, Yulia. Philip had pointed out that effective leadership also requires good followship, quote unquote. It's hard to lead collective accountability if agencies that are part of coordination mechanisms don't accept to follow agreed commitments. And I think, Franklin, you pointed out how you've really had to work with everyone to bring people together and that it takes that staged approach. So really, thank you for that, Franklin, about sharing how you bring that fellowship about. Sarah also said, we talk a lot about empowered leadership and upwards information flows. When do we talk about more empowered communities? Can this be institutionalized while also being very specific to the locality? And I think, Sarah, we're going to have Noella talk about an empowered community approach, I think. So I'm going to let Noella come to that if that's okay. Michelle then said, I think it's good point leadership. It does not refer to leaders or individuals, but strategic action that speaks to institutionalizing AAP, i.e. making it part of procedures and programming processes and not an additional element to comply with. I'm not sure collective approaches can be effective if individual organizations have not institutionalized AAP internally, which Christelle from ICRC agreed with. A collective AAP approach is an extension of internal institutionalization of AAP, and that's a requirement for good fellowship and impact. And Franklin, Philip was saying, good point about collective approaches versus the mechanism. We often focus on the machinery and not always on the approach. And I think, and Michelle was just saying that she liked the identification of the different locuses of decision-making so as not to delay the timely responses that you had pointed out, Franklin. So thank you for that. And I look forward to hearing that your information sharing protocol and the next steps of the work that you're doing in CARA really come to fruit. And thank you very much for sharing that, Franklin. Before I turn to Yulia, just wanted to look at the word cloud where you've all contributed to telling us what are the priorities for improving collective accountability. We've got commitment being the number one priority that's coming up there, then coordination, inclusiveness, communication, leadership commitment didn't come out as strongly here, which I found interesting, even though it's come out very strongly in the three examples that we've heard about, or the three approaches also that we've talked about. Then we've got planning, funding, political will, communication, donor incentives, a common NGO approach. And then we get into some of the other priorities like collective coordination, diversity of stakeholders, feedback from the field, collective outcome, leadership action, monitoring and measuring, using a common framework, prioritizing people, defining AAP and tools, use of qualitative data. So just a few things there. I'm going to now turn to Yulia, and maybe I'll just throw out this question that Amber just put up in the Q&A. As many tools and examples have been shared and tied to AAP operational frameworks, I wonder if we'll see minimum standards for AAP similar to SPHERE, child protection, livestock, humanitarian inclusion, economic recovery, market analysis. We do have the core humanitarian standards, so I would possibly argue that is a minimum standard on AAP, but maybe I can let others come back to that, and maybe Yulia, you'll even speak to that. Yulia, thanks so much for joining us in what is an incredibly busy time, and really appreciate you being with us today. Yulia is the humanitarian advisor, or a humanitarian advisor with OCHA in Ukraine, and is going to be sharing some of the experiences of collective approaches in Ukraine. Yulia, I know that the response right now, you're in the middle of a crisis, but what progress has been made for collective approaches in Ukraine? And also, how well were the AAP structures in the country prepared for the current response?
Thank you, Manisha. Thank you, colleagues, for having me here and for your excellent presentations. I really had a lot of insights that would definitely lead me on the way in operationalizing the AP response in Ukraine. So just to quickly recap, as Manisha said, what has been done and what is being done at the moment. So just saying that since 24th of February 2022, In Ukraine, we had to adjust to the new reality. We have been trying to scale up very rapidly and cover the fast evolving crisis across the whole Ukraine, while initially since 2014, so basically for the last 8 years, we were mainly dealing with only 2 oblasts in the east of the country. So now we're talking about a different magnitude, and this is national and international crisis, and this is the 42 million people country. I am the affected person myself, fleeing the capital with my family on the second day of war. And now this is my blessing and my curse. And I'm also a committed humanitarian. And as the co-chair of the AAP task force in Ukraine, I keep reminding that we must ensure that keeping the humanitarian response with people at the center of it. The AAP task force, just to quickly recap, is the current coordination mechanism that was established by the ACT a year ago in line with the operationalization of the collective AAP framework. It brings on board both the humanitarian workers of the UN and NGOs, both national and international. And we also make sure that in the current humanitarian architecture, the cluster focal points join the work of the AAP task force. So we ensure a silent and needs-driven approach. Ukraine is truly a unique crisis in the middle of Europe, and it is a very digitalized society with a strong government that supports its people, taking the primary responsibility, including by providing regular and updated communications with people affected by the war. The Iran Oblast and city level Facebook pages regularly provide information on the services available, and that is all on their website. As humanitarians, our main task right now is to complement their efforts and to chip in with whatever was the key messages and services available across the system using these channels as well. So the important thing for us is coordinating between these channels so we don't confuse people at the end of the day. As the co-chair of the task force of the ACT in Ukraine, I have been hesitant to go for quick fixes. So thus we agreed that we need to take evidence-based approach and define what are the data gaps, what are the most used information channels. In Ukraine, while scaling up with humanitarian response, we were also challenged to tailor our operation and the work of both the AP task force as well as the task force dealing with prevention of sexual exploitation and abuse to this very unpredictable settings. So our main task is to first, streamline our communication with affected women, men, children, and elderly, and that we provide credible information using the preferred channels, those channels that are used by the affected people. As per the rapid needs assessment of reach and some initial mapping of telecoms mapping, we figured out that we must work to complement the government-led efforts because that is where people actually seek information. On our recent mission that just happened last week to the collective centers, to one of the cities where evacuation trains would arrive, we talked to people, to host communities, and from the very local responses that we found out that people will get information from volunteers and from face networks. They are often the first respondents. And then they would be looking up for the information on the city council website, Facebook page, or Telegram channel. And this is very much spotlighting the idea of localization. And this is very much in line with the recent statement made by the principals of the Interagency Standing Committee on AAP and Humanitarian Action that reaffirms our joint commitment that AAP to be central to principled humanitarian action. In the statement, we reinvigorate on our joint commitment to increase our participation in and support of locally led coordination platforms and local leadership. So the statement says that we must be instructed by affected people to guide our actions and to measure how well we provide protection, provide assistance against their diverse needs, feedback, and perceptions throughout the humanitarian response. How do we do that here and now in Ukraine? Is that what we are currently trying to address? So let me give you an example of cash assistance that has been identified as the primary tool of emergency response in Ukraine as per the flash appeal that was recently launched and will cover the period till August this year. There are many service providers and many channels of information run by different agencies. And one of the main questions right now for the response, should there be one channel? This raises multiple questions and that still need to be considered about referrals, about different programs operating, but how to best explain that to people who just want to access cash assistance. As per the discussions with the Ministry of Social Policy of Ukraine, they are really keen to be a part of any initiatives about complaints and feedback mechanisms and propose to work collectively to harmonize messaging about cash assistance and the approach with the cash working group directly. So we're seeing these possibilities for long-term and really local solutions that are also collective and seek to serve the affected population. So now with the AP task force, we will be working very closely on pragmatic and practical ways of dealing with information gaps, as well as dealing with data safety and the challenges of sharing data between agencies to support referrals on complaints and feedback. We will also look at how we continue to work with the government and support their efforts. This also leads me to mention that what is also critical in our response is prevention of sexual exploitation and abuse. And with the established community-based complaint mechanism that we used in close collaboration with the hotlines in Ukraine, a dedicated email, and a strong network of PSA focal points, we are now working very proactively on raising awareness of the affected population on what is not okay and how to report it in a confidential way. So there is definitely a lot to be done, but what is vital and critical here that we have a good platform and a good basis to ground our work on and a huge support. So definitely more to come.
Thank you very much, Julia, and thank you for taking the time to share the work that you're doing, and particularly when you yourself are amongst those affected by the conflict. I think that point you made about really putting people at the center is so critical, and I think the fact that you've had those systems where you're able to do that and you're able to have the feedback and hear from people directly, and that you've been able to identify those communication channels that people trust and use is critical. In terms of sort of that point that came up with the other presentations around the leadership element, how important is leadership in really pushing the systems that you've got around AAP? Or is it that the systems were already in place and people are happily using them?
No, absolutely. I would say that leadership is one of the most critical elements here. So in terms of the leadership in the country, it is the humanitarian country team that leads the strategic advice and spearheading the whole process. And this is the HCT task force that has been spearheading all the efforts in terms of putting people at the center of the response. In terms of the fast evolving crisis right now, I would like to highlight that actually HCT was very much committed in saying that it is something that has been tabled for the HCT meetings on a regular basis. So we keep updates on the AAP and PSA fronts to the HCT, so they stay abreast and whatever is required to be elevated to their level, to be translated and promoted at the strategic level. They are always eager and keen. In our context, we we are challenged by the fact there are so many implementing partners that we have to coordinate and to streamline the approach, because when we come up with numerous channels, people will just be confused at the end of the day, and this is not our task. So with the strong leadership of the humanitarian coordinator in the country and the strong leadership of the humanitarian country team, we seek to streamline the efforts. And one of the action points that were stemming from the HCT a few weeks ago is that any project that is focused on community engagement and accountability to affected population should go through the AP task force first. So we decide collectively how important and beneficial that would be. And we have the evidence-based approach. It's not that people would be running because there is a donor interest or high demand, and they would come up with numerous projects and would say, hey, we need to reinvent this and reinvent that. And we are now exploring actually many projects and many proposals. And for instance, just to give you a very practical example, we have a very good network of hotlines operational in Ukraine. Definitely, since 24th of February, some of them are not capacitated sufficiently, some of them had disappeared. So we had to start this mapping out of all the operational hotlines together with the protection cluster. And then there was a very high demand for this interagency mechanism, and whether we need a new hotline started from the scratch, or we have to capitalize on the existing ones. And we are still exploring, and we want to take it from a very needs-driven approach, having a proper assessment together with REACH colleagues, with ETC cluster, and see whether there is a need, if the hotline is the very source that people, is the very channel that people are going to be using indeed to provide feedback. Because at the current circumstances, we have this community-based feedback mechanism that was established for particularly sexual exploitation and abuse cases. This is a dedicated email. And as I mentioned, we are heavily popularizing that and raising awareness of the affected women, men, children, elderly, by spreading the postures, by using many channels. And people now have been contacting the SEA referral@u.org for all kind of requests. And most of them, like 40 plus, were dedicated to the multi-purpose cash assistance. It just proves the fact that this is very digital way of people communicating their questions, inquiries that we have to deal with. We have been very much involved in working with the cash working group and dealing how to communicate in a very simplistic way in a one-pager. All the frequently asked questions that people have, they are so simple, like the eligibility criteria. Where can they be enrolled? Can they submit automatically online the documents? And if they, because IDPs are not, they're very on the move. They might be moving from one oblast to another one, from one city to another one, seeking for better opportunities for their families, and they are allowed to know whether it is okay if they enrolled in one city to receive assistance in the different one. So these are very top 5 questions that we have been asked through this very separate email dedicated channel, right? So we came up as one pager, and as I mentioned, with the Ministry of Social Policy that is really eager and very much keen to support the efforts and to have this harmonized approach, we can capitalize on the platform even run by the government and replicate the messages. It is the only thing is the credible information that we provide. It should be a timely information, and now this is all about cash assistance, multi-purpose cash assistance. It's all about that, and we should be using the channels that are used by the affected women, men, kids, and elderly, and definitely with a strong leadership and a full discretion that is given to the AAP task force to deal and to be guided by the voices of the affected population. This is how it should be done. So no quick fixes, not that we came up and decided to do it because we are the humanitarians and we know better. No, that's not the way we have to do that. And yeah, thank you so much.
Thank you very much, Julia. And you've largely answered a question that Hamdi had about, can you share steps on identifying mechanisms that affected populations trust and share their feedback through? So thank you for that. And I think it's a point that Hamdi made about most organizations have challenges that affected populations don't use some of the established mechanisms. So the way that you've really gone about looking at what are those channels that people trust and then using those, I think has been critical. I'm going to apologize to all of you right now. We're going to end up going a little bit over time because we still have Noella to hear from. But Julia, thank you so much for that. And I know that I realize we've got too many speakers for an hour and a half, but because you've all had such amazing experiences to share. So I apologize in advance to everyone in the audience, but I want to make sure that we also give Noella enough time as well, because I think her experience is really going to be looking at that point about empowered communities. And Noella is with the Refugee Engagement Forum in Uganda, working with the Comprehensive Refugee Response Framework Steering Committee. So Noella, I want to turn to you because coming from an affected community, I think we really would love to hear sort of your experiences. How has the Refugee Engagement Forum worked? You know, how does that mechanism function? And is it conducive to collective accountability? And are you able to reach humanitarian actors in a meaningful way? Noella, please, love to hear from you. And maybe I could also just say, sorry, I should have said that the Refugee Engagement Forum is a collective initiative involving the UN, INGOs, government, and a local network of NGOs. And it was established in early 2019 with a mandate to facilitate the meaningful participation of the affected population in Uganda's refugee response, and particularly around that CRF steering group. So the IASC task force may have some lessons to learn in terms of identifying an effective way of bringing affected communities in and being able to hear them effectively, I hope, because we'll hear from Noella as to, does this structure work effectively? Noella, please. You're on mute, Noella.
Thank you so much, Manifa and colleagues, for having the refugee voices in these engagements. I'm very grateful about it. I must say that Uganda, being a country that hosts almost 1.6 refugees, you establish Refugee Engagement Forum as one among the structures that translates really the meaningful participation of refugee in the national coordination. And I also say that the establishment of Refugee Engagement Forum is one among the greatest indicators that shows that a country that hosts almost 1.6 refugees account to its affected population. This structure, I could say, yes, it's somehow conducive. Why? We, as the refugee representative, we are able to reach, first of all, to our community and present their voices to this high-level national coordination. But what I need to bring to light is that very few partners are part of this movement. However, we would like to see a lot of partners coming in. The response are accounting directly to the affected population. This is one. We actually want to see a huge number of all the partners that are involved at country, at settlement level, in urban level, within the refugee response, to be accountable to us. This is what I would say right now. Thank you.
Thanks very much, Noella. And can I ask, I mean, in this sense, you froze a little bit there, but I think I heard you say that currently there's not that many partners involved, but that you need to get more engaged. You want to see more partners that are in the refugee response really being part of the accountability system. Why is it that you don't have more partners engaged, and what is it that's stopping them from being engaged?
Okay, I think I'll say in terms of visibility, first of all, we need to create more visibility about the Refugee Engagement Forum. Why? Because the Refugee Engagement Forum is one among the successful pioneering refugee participation mechanisms that was designed to systematically ensure that refugee voices are taken into account in national decision-making processes. However, we need to do a lot in terms of visibility, both at a settlement level and country level, to ensure that Ref Engagement Forum is known, and whoever who is involved into the refugee response should be partial and part of it. This is what I'm saying, that not so many partners are involved. However, our prayer is that all of them comes and join the Refugee Engagement Forum, such that all are accountable to us. Remember, the Refugee Engagement Forum was created to ensure that refugee voices are reflected in the aids and the support they receive. Yeah, thank you.
I think that's a really important point, Noella, that, you know, it's making sure that all those organizations really do get engaged. In that sense, is there a need to push kind of the senior leadership of those organizations more to really engage in the Refugee Engagement Forum? Or is there a need for more incentives to push them? You know, what's your recommendation to really get those missing partners on board?
Yeah, I must say that by nature, the Refugee Engagement Forum itself, first of all, it has a very innovative approach. It informs the decision-making process. Once we are engaged as refugee leaders, our voices really are heard and listened to. It can also be served as an inspiration to other countries to adopt and learn from. However, our prayer is that a coordination mechanism be created when it comes to the partner that are serving the refugees. Once that coordination is, the mechanism is created, all partners will be part of the Refugee Engagement Forum, and that's why we shall see that the accountability is reflected.
And maybe I could just ask you, how is the Refugee Engagement Forum set up? You know, what's the structure? Who's part of it? How is it, you know, been, because you said it's innovative, yes, and that it's a good example. Can you just give us maybe a few more details so that others can try to replicate it, whether in a refugee situation or even an internal displacement situation?
Yeah, thank you so much. I'll say that the Refugee Engagement Forum, it's a forum that brings together the refugee leader across the country, both settlement and 7 refugee representatives. These are leaders that are elected, and these leaders, we sit. The leader conducts consultation, gathering with the community directly, and then the leaders, they convene to review and discuss at a quarterly refugee meeting to identify the key concern. And these concerns are presented in form of key messages at the quarterly CRF-SG session. Then at the end, we report back to our community through a widely sharing outcome. So this is already a huge national platform when it comes to refugee meaningful participation. However, what we pray and demand is that a lot be done in terms of strengthening its existence and also following up on the key action and solution that are always proposed during our REF meetings. It also has, I think, a lot of challenges that we have encountered since its creation and establishment, whereby we have been greatly affected by COVID-19 and its restriction. Why? We need to use, before the COVID-19, we used to meet a huge community, but because of the restrictions put in place by the country, we couldn't reach a lot of community members. So this is one among the key areas where we want really people to support the REF. And also, in terms of sustainability of funding, we are lacking a lot of funding for it to sustain effectively. So we are calling upon, again, the partners to join such that we make a huge impact. Remember, we are using REF as a platform to account and to account on how we serve the affected population. So I feel like we need to be supported, and we need to strengthen awareness, more especially to maintain the support and secure further finance aids in order to empower the ref, realize some of the areas of growth. And then also, I feel like, we need to focus more on the refugee community holistically, such that they feel empowered. Thank you.
Thank you very much, Noella. And I think that's an amazing example of really how you're able to consult broadly and then be able to take those concerns to the humanitarian actors and also government involved in the CRRF to get that accountability, but fully take on the point that you said about needing more partners to join, also to ensure the sustainability of the REF and to really take up those concerns and commitments that you've raised. So thank you so much for sharing that really inspiring example. And hopefully that can also feed into the work of the IASC task force that Jesse talked about at the beginning, as they're looking at ways of bringing in the voices of affected communities and individuals. So huge thanks to all our speakers. Before I wrap up, I just wanted to come back to each of you to just have a last thought or a last parting thought that you want to leave us with in terms of collective accountability around AAP. Is there one takeaway that you want to leave us all with? Maybe I'll go in the same order that we heard from all of you. Sorry, Jesse, to put you on the spot right away. But Jesse, one kind of takeaway for us to remember from today's conversation for you.
Thanks so much, Manisha, and thanks to everybody. Just a great discussion. So I have many things I would want to say, but my one is that it's not about individuals, but it's about the institutions. And that's where we need to focus our efforts amongst a number of other strands. And we'll take that forward in Task Force 2. And I do hope that everybody on the call today finds one way or another to be involved in that. Thank you.
Super. Thanks so much, Jesse. Omar, one takeaway from your side, please.
Thank you, Manisha, and thanks for this great discussion, really. From my side, I just, wanted to highlight it's again AAP, and this is one of the main challenges we keep, facing. It's not about community or feedback mechanisms. It's about more information sharing with the communities for the decisions affecting their lives, and also it's about engaging them. We are working for them. And this is the main issue for all our intervention. And then it's about feedback mechanisms and course correction. I learned a lot from this session today. Thank you all. Over to you, Manisha.
Thank you so much, Omar. Franklin, one takeaway from your side.
One takeaway is for the AAP to thrive, we need to have a collective approach to engage with community and a strong leadership, and to make it a normal practice of a delivery process. Thank you.
Great. Thanks so much, Franklin. Yulia, one takeaway from your side.
Yeah, thank you, colleagues, for an excellent opportunity today to listen to all this invaluable experience that you must be going through. My takeaway would be that we must be advancing collective accountability at country level, and we must not, as humanitarians, be coming and reinventing the wheel, but rather than that, be capitalizing on the good work, on the government-led initiatives, and be listening to those that have been affected by the crisis, by the war, because these are the people that are looking for the information, that they require assistance, and we must be here to serve, to provide only credible information with the reliable channels, and not be coming up with numerous initiatives. So a streamlined communication, credible information, and the reliable channels would be one of the prerequisites of our success. Thank you.
Super. Thanks very much, Julia. And Noella, last but definitely not least, one takeaway that you'd like to give us.
Yeah, I'll say refugee meaningful participation is no longer a tokenism. It's something that it's lived on a daily basis. So if anything it means for us, all the partners should be both part and partial to whatever discussion involving them. We stand with one call. There is nothing for us without us.
Wonderful. Thank you so much. And I have to say, this has been an incredible panel. So thank you to each and every one of you for sharing the incredible work that you've been doing and the experiences. And I wish we had much more time because I still had many more questions. And I know there was a couple of things around, I know, sorry, Philip, we get to your question around hearing views on how well existing standards like the core humanitarian standard and SPHERE can help drive more effective and accountable programs and relationships between aid organizations and populations that have been effective. But that'll be explored in the CHS revision process, which I hope all of you will be part of. But I think really today, all of you have shown that we are making incredible progress in different responses on collectively approaching accountability to affected populations. And I think it came out very clearly that we need to be looking at it internally as institutions, but then bringing that institutional commitment and approach to AAP to that collective approach. And if we don't have that collective approach that is brought through with strong leadership, we're not going to be effective in how we're making sure that we are accountable to affected populations. And I think, Noella, as you very well put it, it is critical to be accountable to those who have been affected, whether they're refugees, as in the case in Uganda, or if they're internally displaced, or if they're host communities. We really need to be finding those mechanisms collectively to hear from people, get that feedback, provide credible information, use those channels that already exist instead of reinventing the wheel, and really putting those together so that we can do the course correction and that we make it part and parcel of everything we do, not an add-on, not an optional thing to do, but that we really have to have those systems in place that make all of our programming much more accountable to affected populations. So huge thanks to all of you. I know that there would be many more things that all of you could share, but really look forward to seeing the IASC task force paper coming out soon, the research that was done on the whole of Syria coming out soon. I know that Veronique from ODI had shared something in the chat earlier on the CAR approach that they did with Franklin. So that's another really good resource. I'm sure, Yulia, with the Ukraine response continuing, hopefully the conflict will end soon and that you will be able to go back to recovery quite quickly. But I know that there'll be many lessons that will be coming also out of the Ukraine response in terms of how you're using the systems that are already there. So we'll need to be looking at that. And Noella, I think the way that the Refugee Engagement Forum has been set up is a really critical example for lots of us to look at to really see how that engagement and listening and being accountable to refugees has been used. So huge thanks to all of you panelists for fabulous interventions today. A recording of the event, both in video and audio only podcast format, will be available on the event page with that link right there on the screen for you, will be available in the coming days. And I would love to invite you to join us for our next session on AAP during the HNPW this Friday, where we'll be discussing a standardized approach to complaints and feedback mechanisms. And that's this Friday, the 6th of May at the same time, so 9 o'clock Central European time. With that, huge thanks again to all of the panelists, to everyone in the audience, also for sharing your thoughts in the chat and in the Q&A, to, I believe it's Ellen who's captioning for us. I apologize if it's not Ellen, for the captions today. And huge thanks to everybody for being with us today. Really appreciate your time and apologies for going on, but I think we had such amazing interventions and examples that I didn't want to lose any of that. So also thank you to our interpreters. I forgot to say that, I apologize. And yes, Ellen for the captions. So thank you all, and I wish you a very good day and hope to see you all back here on Friday and to discuss AAP some more. Have a good day or evening, depending where you are.